Hey, YouTube Nation. Dr. Pittman and the Vein911 team. This is Miss Martinez. She's a world traveler, real neat lady, and she presented to us with a superficial phlebitis. It's a fancy word for she had really bad varicose veins, and some of them had clotted off. And when that happens, it's often painful and can lead to other problems. So she presented with pretty advanced vein disease, and we've since closed down her veins with laser and ultrasound-guided foam sclerotherapy. And now we're doing what I call the fun part, which is the cosmetic aspects. We're getting rid of some of her spider veins that she has. And yeah, you know, one of our taglines is schoolgirl legs for everybody. So that's what we're doing here today. We're using foam sclerotherapy on her spider veins. It's a little more effective. It's a little avant-garde to use foam and not liquid, but foam is quite effective, and that's mostly what we use here at Vein911. So anyway, if you look at her leg, she's got some dark areas. Those are some larger veins that have been already closed off. Actually, some of these aren't the result of our therapy, actually, but because she had such severe vein disease, it really had been neglected. And after a while, when veins have been under the skin and under pressure for a long period of time, blood will leak out, and the iron in the blood will stain the skin a dark color. So some of this, or actually most of this, has been here for many, many years. So that's what we're seeing in some of these different areas. But anyway, we are simply doing a little foam sclerotherapy here today, and we use a needle the size of a hair shaft, literally. We've never had anybody hit us, cuss, or leave for anything that we do here. Even flinching would be an exception. You can see it's an extraordinarily tiny needle. And what I'm doing here is I'm kind of pressing on the skin to see if these little spots fill with blood, and if they do, then I know that's a small spider vein. And it's often difficult to appreciate on camera, but when we inject these, it's a lot like an Etch-a-sketch. They disappear before our eyes for about a minute, and then what happens is they come back and get red and inflamed, and that's a good thing, because when they get inflamed, that means they're going to scar up and go away. Now, Miss Martinez has obviously likes the sun, spends some time in the sun, and so that masks some of the cosmetic issues with her, and is not going to show. It's not going to show the Etch-a-sketch effect as well. Yes, let's get a little more. So what Amber, my physician's assistant here, is doing is she's preparing fresh foam. We want to make sure this foam is, you know, 1 minute to 2 minutes old, because the fresher it is, the better it is. And maybe difficult to appreciate, but this entire area just disappeared with spider veins kind of before our eyes, and it will fill in about a minute or two and look a little bit pink and inflamed. And here we're doing that again, and you can see about a half an inch around this area, those spider veins just kind of disappeared. Again, with her tan, it's not quite as obvious, but what we're going to do now is ankle's a little more tender, but it's still well tolerated, and it's also a very common area for spider veins, and you know, cosmetically not a good area, because you know, people wear open shoes and things like that. So anyway, you can appreciate there, I'm very gently injecting, not a lot of pressure. As you can see, this area is free of spider veins, at least for a minute. And what I'm going to do is I'm going to kind of push this foam into other affected areas. And again, this is a little tender in the ankle here, but again, inject this gently, you'll see an area. So we're going to do that all through the ankle here, and over time these will just disappear. It's really a lot of fun. It never gets old. It's like a video game, and it's just a lot of fun.
So if you want to read up an article about...
Yes, indeed. We have all sorts of information at our website, Facebook, YouTube, and even a tweet every now and then. But mostly Facebook and our website. I'm what I call a recovering assistant professor. I like details. I'll talk to patients about details till they don't have any questions. But at our website, I've got just tons of information. People should always do their homework, before they submit to any kind of medical care. And if you do your homework, at least in the Tampa Bay area, I think you're gonna come see us at Vein911. What I haven't explained is what I call the nutty professor glasses. There's practitioners out there that are going to do foam sclerotherapy or liquid sclerotherapy with just the naked eye. Now my eyes are fine. I got good vision, even though I do have the glasses on, I think. But you can't do the best possible job getting rid of spider veins if you don't use these glasses. Just period, check, end of story. It's not just the magnification and the high intensity light, but this company called Cirrus has a patent on some polarization technology, and it's that third thing, or the polarization, that makes these veins stand out like a white shirt in a black light room. So you can actually see about 0.1 millimeter under the skin. So we can see spider veins even the patient can't see with this technology. And so Vein911, we're best in class vein care, world class vein care, and we're going to use all the latest and newest technology that's going to give us an edge. And one of those is if your sclerotherapist is not using a device like this, I just, in my humble opinion, it's not the best. They can't do the best possible job. Just can't happen. Now Amber over here, she's got much younger eyes than me, and even she'll admit we fight over these glasses because she does a lot of sclerotherapy. Yes. And she realizes, like I do, you just can't do the best job unless you use these. So make sure your practitioners got the Cirrus device. And I don't work for these guys. Trust me, you get no kickbacks. It's just incredible technology, and helps us do the best possible job. Yes, yes. So you can see Miss Martinez here is in a lot of distress. She looking beautiful there, and she had her iPod earphones in there. Some people talk to their family, read Good Housekeeping, or work on their iPads while we're doing this, or they take a nap, or we chat. But it's incredibly well tolerated treatment. I think a lot of people are hesitant to get their spider veins treated because they think it's going to hurt, and it just plain doesn't. It is a tiny, tiny needle. And some people are going to ask, well, is laser treatment of a spider vein better than needle sclerotherapy? And the short answer is injection sclerotherapy is still the standard of care in the legs. It's the most effective treatment. It's much more effective than laser, and frankly hurts a lot less. Laser, you're going to feel laser, and it's just not as effective. And any phlebology expert or vein care expert will tell you that injection sclerotherapy is the way to go for spider veins of the legs. Very, very effective technology.